Did you know lupus can silently damage your kidneys, even before you feel anything wrong? If you wait for symptoms to show up, it might already be too late. Let's talk about how to catch it early and protect your kidneys starting today. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My mission is to help you live pain-free and healthy using modern, effective, and lower-risk treatment options. Today, we're diving into one of the more serious and often hidden complications of lupus nephritis, or lupus-related kidney disease. If you or someone you love has lupus, this is one of the most important topics to understand. Your kidneys are vital. They filter your blood, balance your fluids, and help control your blood pressure. When lupus affects the kidneys, it can lead to permanent damage if not caught and treated early. But here's the good news. We have better tools than ever to detect it early, treat it effectively, and help you live a full and healthy life. So today we'll cover what is lupus nephritis, why it happens, how it's diagnosed, what signs and symptoms to look for, what treatment options work best, and how lifestyle plays a major role in protecting your kidneys as well. Let's get started. So what is lupus nephritis? Lupus is an autoimmune condition. That means your immune system, which normally protects you, starts attacking your own body. It can affect your joints, skin, lungs, brain, heart, and in some people, your kidneys as well. When lupus causes inflammation to kidneys, we call that lupus nephritis. Here's a simple way to think about it. Imagine your kidneys are coffee filters. Their job is to clean your blood, get rid of waste, and keep the important stuff like protein and blood cells inside your body. When lupus nephritis sets in, those filters get swollen and clogged. Waste starts to build up in your body, and the good stuff starts to leak out. Over time, if that inflammation is not treated, it leads to scarring, and once enough scarring builds up, your kidneys can even shut down. So why does lupus affect the kidneys? In lupus, your immune system makes autoantibodies. These are antibodies that attack your own healthy cells. They form clumps in your bloodstream called immune complexes. These immune complexes get stuck in the tiny filters inside your kidneys called glomeruli. When they get stuck, they can trigger inflammation. Your body tries to fight the problem, but ends up damaging the kidneys in the process. This inflammation makes your kidneys leaky, raises your blood pressure, and eventually causes scarring. Lupus nephritis affects about 40% of people with lupus. It usually shows up within the first 5 years of diagnosis, but sometimes it's the first sign of lupus. It's more common in the following populations: young women, especially between 15 and 45 years old, people of African American, Hispanic, or Asian descent, and in those with more active or aggressive lupus. If that's you, regular monitoring is essential. Here's the tricky part. Lupus nephritis often starts silently. You might feel completely fine, even as your kidneys are being damaged. But some signs to watch out for include swelling in your legs, ankles, hands, or face, foamy or bubbly urine. This means protein is leaking out. High blood pressure, especially if you're young and otherwise healthy. Fatigue or low energy is common as well in lupus nephritis. And less urine output or darker colored urine can occur as well. Even if you don't notice symptoms, lab testing can pick it up as well early. There are a few ways we screen and check for lupus nephritis. Urine testing, to look for protein or blood in your urine, is a very important screening test. Blood tests to measure your kidney function. Blood tests can also look at markers of active lupus disease, including your complement levels, which help us measure overall lupus activity. They can also measure your anti-double-stranded DNA antibodies. These tend to rise during lupus flares as well. Kidney ultrasound will frequently be done as well to rule out any blockages and evaluate for other kidney structural issues. And most importantly, if there is a high degree of concern that you have lupus nephritis, a kidney biopsy will be done. A biopsy tells us how much inflammation and scarring is present and helps us classify the lupus nephritis. There are 6 classes of lupus nephritis, and the treatment depends on which class you have. Let's simplify this a little bit more. Class 1 and 2 of lupus nephritis is typically mild. Class 3 and 4 typically means that you have moderate to severe inflammation that can really damage the kidneys very aggressively. Class 5 tends to involve more heavy protein loss, and Class 6 is considered end stage, where there's too much scarring, often leading to kidney failure. If you're in Class 3, 4, or 5, you do need to treat this relatively quickly to prevent long-term damage. Let's talk about treatment options that work for lupus nephritis. The main goals of treatment are to control inflammation, prevent flare-ups in the kidney, and to overall protect your kidney function. Here's how we do that. The fastest treatment that will be utilized are corticosteroids like prednisone. Steroids work very fast and they do work effectively, but you need to be careful about using them long-term, and there has to be an attempt to taper them down over time in order to avoid a lot of the long-term side effects that you see with that treatment. That then leads to some of the other immunosuppressants that are frequently used for lupus nephritis. That includes Cellcept, azathioprine, and cyclophosphamide. These calm the immune system down to stop kidney damage and are generally utilized longer term in lupus nephritis. Then you have newer biologic treatments like Benlysta, Lukinist, and Cefnello. These are newer treatment options that target specific parts of the immune system with fewer side effects. These are made specifically for lupus, which makes them good options if more aggressive treatment is needed. You then also have blood pressure medications like ACE inhibitors. They protect your kidneys even if your blood pressure isn't high. And then lastly, we'll also talk about lifestyle changes, which we'll get into next. So let's talk about lifestyle tips to help protect your kidneys. You have more control than you think. Here's what helps. You want to cut back on salt. Processed foods can increase fluid retention and blood pressure. You want to stay appropriately hydrated by drinking enough water. Stay hydrated, but don't overhydrate. You want to get regular exercise. Even walking 20 minutes a day can help to reduce inflammation. Sleep well. Poor sleep makes inflammation worse. You also need to manage your stress level, importantly. Meditation, breathing exercises, and yoga, whatever works for you. And stay consistent with your medications and your follow-up appointments with your rheumatologist and nephrologist. Lupus is a condition that fluctuates over time. The best way to ensure your lupus is under good control is by closely monitoring your condition and staying connected with your physicians during this process. If untreated, lupus nephritis can lead to permanent kidney damage, swelling in the lungs and heart, dangerously high blood pressure, and kidney failure, eventually requiring dialysis or a transplant. But with appropriate early treatment, most people live normal, healthy lives. Let's discuss common misperceptions as well as frequently asked questions that I hear from patients. Number one is, if I feel fine, my kidneys must be fine. That's not necessarily true at all. Damage can happen silently. Number two is that steroids are my only option. Absolutely not. Steroids do have a role in lupus nephritis, but we have newer, more targeted treatments that are safer and more appropriate to utilize long term. Number three, lupus always causes kidney failure. Not true at all. Early, appropriate treatment can protect your kidneys for your entire life. Number four, some common questions that I hear: will I need dialysis? Only if treatment is delayed or ineffective and your condition aggressively progresses. And number five, can I live a normal life? Yes, with the right care and lifestyle, you absolutely can. Some key takeaways here: lupus nephritis is serious, but it's manageable. It often starts without symptoms, so regular testing and screening is key. We now have more effective, safer treatments than ever before. And while some simple lifestyle choices can go a long way to protecting your kidneys, you also need to make sure you maintain appropriate follow-up with your physicians as well. Thank you for watching. If you found this helpful, like, subscribe, and share this video with someone who needs it. Visit us at chicagoarthritis.com for more expert content on lupus, inflammation, and staying healthy. If you or someone you love is dealing with lupus, schedule a consultation with us as well. We'll create a personalized, evidence-based treatment plan to protect your kidneys and support your long-term health. Again, this is Dr. Siddharth Dambar. See you next time, and live well. Bye-bye.